Last day, postpartum. All right, our goals are to nurture and provide emotional support, facilitate the restoration of pre-pregnancy physiology, alleviate muscle strain and fatigue of labor and birth. That was a lot of work. And then promote pelvic floor healing and comfort, rebalance pelvic and spinal structure realignment, restore and normalize abdominal structure, facilitate healing from a cesarean birth. Hopefully we don't have to deal with that. And prevent and reduce back and neck pain from newborn care. So, maybe like a 10-pound dumbbell or even a 5-pound dumbbell, it's not so heavy when you just pick it up. But if you had to hold it all day long, like you start getting tired, even if you work out. But, and then it's just not that. Then you have the car seat and a diaper bag and your purse and a stroller, and it goes on and on. So and then this lady, you can see just like there's a lot of bonding going on from eye to eye contact. And so while breastfeeding, moms are always like gazing at their child and then holding that weight in their arms. So I kind of laugh at, like, remember the old Taco Bell commercial, the taco neck, when they're like eating it. So I'm like, it kind of reminded me of that.
Baby neck.
Yeah, baby neck, because always looking the same way. And then, of course, having a baby, all the positions you get into and holding yourself up and getting on all fours and then squatting. And yeah, you're just like, yeah, that's why it's good to exercise throughout pregnancy and get in shape. And hopefully you do it in preparation of preconception before you even get pregnant, so that you don't have to start something when you're pregnant. That's not really the time to start doing it. But in any case, women are pretty much feel like they've been hit by a Mack truck after they have a baby. And then the problem is that they usually don't come in for a couple months, because that's when they get released from postpartum care and they're ready to get a full body massage again. So with massage, when they do start coming in, it's better if the baby's not in the room. A lot of moms don't want to be away from their baby, especially if they're breastfeeding. But it's like, to me, it's okay if they bring somebody along and that person's in the room with them and the baby. But if they just come by themselves with the baby, I've had to pick up the baby when the baby's crying, put the baby on the table with mom so she can breastfeed, which sometimes takes up to 20 minutes or longer. If they have a 1-hour massage, and then you have to change a diaper and breastfeed, and then, like, I feel kind of guilty then, like, should I, I don't want to charge them for the full hour, but again, that's my time. I could have had somebody else in, so I have to.
Maybe the husband can watch the child while the mom comes in, or grandparents.
Or leave baby at home, like breastfeed right before you leave, come in, get your massage and get back. But then they're usually stressed about time. So I actually think it's better if they bring the baby along, but have a babysitter come along and tend to the baby. And if the baby starts crying, you can either like let the baby see mom and know that mom's still in the same room, and then they're usually okay. Or step outside, or, go into the lobby with the baby so it's not disturbing mom. But usually if she hears her baby cry, she wants to tend to her baby. And, so it usually works good if it's like grandma or the dad or somebody the baby knows, then that's good. But if it's a babysitter, then, baby wants mom, and it's really kind of difficult. And so one other thing you could do is do house calls, and that works really great. Like if you want to build up a postpartum clientele, then house calls is really a great way to go, because then they don't have to leave. But either way, it's going to take extra time on your part dealing with that if the baby's around, right? So just something to consider. The other thing is their breasts will be filled with milk, and so they'll be leaking. So I usually put a towel underneath the sheet so that if they leak, then it goes into the towel and not onto the like fleece covered pad on your table that can't be washed, or not on top of the sheet so that the terry cloth, their nipples are going to be really sensitive from, you know, this new suckling from the baby. And so sometimes they feel like the nipples are going to fall off, and just the abrasiveness of a cloth, of a towel can hurt. Or a lot of women will leave their nursing bra on with their pads in their bra, and I just unhook their bra while I work on their back and then hook it back up when I'm done with the back, always asking permission to unfasten and refasten. In pregnancy, we talked about the contraindication of deep tissue on the inner thighs because of the blood clot and the great saphenous vein that goes down there and gets filled with blood clots. And that actually is still a risk 8 to 10 weeks postpartum. So we don't want to do any deep tissue on their legs. We can do light effleurage, again, circulatory.
Like petrissage is okay, like it's light?
Yeah, I just wait not until they're released from postpartum care.
Okay.
So it's safe to do massage the day of having their baby, the next day.
Effleurage on legs, then.
Yeah, I usually just stick with back and neck, and like low back, hips, neck, and shoulders until they're released for postpartum care. So I treat it like they're a high-risk pregnancy and just keep it to the back and neck. And then once they get released from postpartum care, 8 to 10 weeks later, and like I said, you usually don't see them before that anyway, because they have to learn how to take care of a baby if it's their first child. You know, that's a whole lot of new learning for both the baby and the mom. So maybe if it's a second or third kid, they're a lot easier getting out of the house and they're ready. But as far as doing a full body, I wait till they're released from postpartum care. And then even after it's healed, if they had an epidural, you can see in the middle photo there where the needle went in, that area can be really tender even up to like a year later. And it will need some work. Usually after about, you know, I wait for a good 6 months after birth, and then I'll do some cupping over that area. Because with cupping, you can lift up and you can glide over a spine without putting pressure on any of the nerves or the bones. And you can actually break up some of that scar adhesion on the epidural site, allow more blood flow in there, just using a tolerable amount of suction with the cup. And yeah, so, and that will help it heal quicker. And, but it'll be, if you're going really deep, you know, pushing down a back, doing the paravertebrals, just know that like you might have to lighten up around that site where they give an epidural so that you don't hurt them. And there might be emotions that are around that too, just like a C-section scar, because a lot of times C-sections aren't planned and they're an emergency. And there's a lot of emotions that happened at the time. A lot of adrenaline, fear, norepinephrine, all those kinds of things. And then those are stored in the cells. So when we go back and we work on that scar, to do scar work, again, you can do cupping or IASTM, or just with your hands if you know how to do scar work, and skin rolling. We can actually work on that scar. It is pretty low, so it depends, like, again, where you work. Like, maybe you're not even allowed to go on the stomach. Some people, you know, some places, chains don't allow you to work on the stomach. But this is like, you know,
Yeah.
right down there by the pubic hair line. And so if you're working on that area, if you're allowed to, there's a lot of emotionals, and it's not uncommon for a woman to get a little misty, teary-eyed, even cry. And then maybe you want to tell what happened about her birth story to you. And Sheila Kitzinger talks about emotional issues, and there's a link in the references of her book. And I have a quote on here from her that women need to recount and tell their birth story. Psychological integration is critical for recovery, whether it's a celebration or a sadness. Either way, like, that was really something. It's like the most profound thing you'll ever do in your entire life, and you don't really, doesn't come up in conversation. Like, you have to process that thought. So that might be a time though that they need to do that, and it's really important to do active listening. And I think in the notes I did include a handout on active listening skills. So I won't talk that much or preach about it here. So, but if you're not sure how to do active listening, that's a good skill to learn. Okay, sometimes there can be some dangerous postpartum complications. So there's some warning signs. If they have systemic or pitting edema, a fever, probably wouldn't come to you for massage if they had a fever, but maybe they don't know. You feel warm to the touch. Women bleed for, it's different for everybody, but on average 6 to 8 weeks postpartum. It's different than a period. It actually does have a smell to it. It's called lochia, and there's a certain distinct smell to it that is normal. But if it's foul smelling, odorous, it could be infection. So that would be a danger sign there. A flaccid, unresponsive uterus, increased urinary frequency or burning urination, tender, inflamed, and hot area in the breast, or flu-like symptoms. So there are a lot of different things. You know, you could have urinary tract infection, you could have a postpartum preeclampsia, you could have mastitis in the breast. So a lot of different things, but those are some of the symptoms of those. And like I just mentioned, postpartum preeclampsia, we talk about it in pregnancy, about preeclampsia, but people don't really realize that you could get it postpartum too. So I want to bring about awareness, and I have a video in here. That's why her face is in here. Let's see. This is a YouTube video, so I'm going to try to connect this, and then I'll probably have to switch my sharing once I get it. So there are some main issues that most postpartum women are going to go through. So we'll go over those. One, preparing for parenthood, of course. Especially if it's the first time. Impacts on your life socially, economically, and in your relationship, both with your partner and with your friends and with your other children if it's not your first time. There's a lot of different relationships and changes going on. Concerned about your libido. If you remember when we talked about some of the hormones when you are breastfeeding, most women aren't interested in sex. It's a natural thing that those hormones do. After pains, so when you're breastfeeding and that nipple stimulation from the baby nursing will make the uterus contract. So the more that you breastfeed, the more your uterus will be contracting. And a lot of times that's unexpected. Not everybody knows about that. So, but that's a natural thing. And if you know what's going on, you can deal with it. Actually, it is, those pains are a little bit worse with subsequent pregnancies postpartum. So your first baby, you'll be like kind of like a period cramp while you're nursing. And then like the next kid and the next kid, it seems like each kid, those after pains are a little bit worse when you breastfeed. They also a lot of times are dealing with hemorrhoids or tears down below at the same time they're trying to take care of this baby. The lochia is the bleeding that lasts for 6 to 8 weeks postpartum. You can't put a tampon in, so they're walking around with a pad that a lot of women aren't used to, and a sore down below. And that's another reason they don't come in to get a massage, because they'd be horrified if they were laying on your table and then they leaked and then you got blood on your table and all that kind of stuff. So most women don't come into a massage office until they're released from postpartum care. But there's a lot of mental health issues, and our mind and body are connected. So we need to talk about that a little bit, what's going on, and get them help and recognize the signs that you might be the only person that sees these signs, so you can let them know if they need help. We also have some of these musculoskeletal issues. If there's trigger points that develop in pregnancy and they're left unresolved, it can lead to chronic back pain. We have restricted posterior structures, and unhealed diastasis recti combined. So if our low back is really tight and there's no support in the front, we're going to have chronic pain. It makes sense. So we have strained joint structures in the sacroiliac joint, lumbosacral joint, and the pubic symphysis joints, and that can create chronic pelvic pain. Lack of tone in the pelvic floor, the psoas muscles, the abdomen, and that may contribute to pelvic instability, urinary incontinence, and pelvic pain. And adhesions in the abdominal or perineal scars may restrict movement and create myofascial strain, postural imbalance, and organ dysfunction. So, you know, we could brainstorm and think of all kinds of myths and misconceptions that people talk about of being a new parent, but I'm just going to go ahead and go through this. But if you're at home, you could pause and think about that. All right, so pregnancy and childbirth is a wonderful experience. Motherhood is instinctive, and you're going to know exactly just what to do. So I think it's instinctive to want to help, but to know what to do is not instinctive. Whereas having a baby may be an instinctive thing. Raising a baby and responding to cues is not always instinctive. That's a learned thing. We have to learn from others on how to respond to babies. You'll have a beautiful, healthy baby. So I think a lot of people, they see these cute babies on the Pampers commercials on TVs or whatever, and you're expecting the baby to look like that right after it's born. And a lot of times it has, you know, it's all red and wrinkly and got cradle cap and just, you know, it's you're thinking, what? But breastfeeding is instinctual. Both you and your baby will know how to do it, you know, sometimes, but there is much to know about breastfeeding as there is about childbirth, and it's never ending. I've been doing it for 28 years, doing like about pregnancy, and I'm still learning new things all the time. I'll never know everything. And breastfeeding is just like that. So I think it's really important to see a lactation consultant and take some classes about breastfeeding before you even have your baby. And rather than wait till afterward and trying to get help. It's a lot easier if you know about some of those things and problems, and you'll know what to do if you have them. Some moms just pick up their baby, put it to the breast, and they latch on and no problem. But another misconception would be you're going to be a perfect mother. There's no such thing. This is supposed to be the best time of your life. Good mothers don't get depressed. Come on. Okay. So here's some statistics that I found. 10 to 15% of all US women suffer from some sort of postpartum mood disorder, approximately 800,000 to 1 million per year. And we don't hear about it that much. So each year, approximately the same number of women will get diabetes. And we hear about that a whole lot more. Also, statistics show 300,000 women suffer from a stroke each year. And 205,000 are diagnosed with breast cancer. So we hear about breast cancer way more than any of those. And postpartum mood disorders affect way more. So lower income or ethnic minority women in Los Angeles had rates of depressive symptoms closer to 30 to 40%. And then, so etiology is like kind of the why. Why is postpartum depression high? Why does it happen? Part of it is the rapid hormone changes, and that's why I mentioned about the placenta yesterday. I don't know if we had the recording on when we were talking about it. So, but basically what we were talking about was after labor and the baby's born, then the woman still has to push out the placenta.
And that's why you eat the placenta to get all that stuff back, all the.
Correct. Yeah. So that's why some people eat their placenta, but like a lot of people, they just throw it in the garbage and they don't even think about it. Like they don't even like do anything with it. They just, like it's not even a consideration.
I don't think it's known. I didn't know until Crystal told me she was doing that with hers. I had no idea.
Yeah.
And I didn't know why. I was just like.
Yeah. So every other animal, eats the placenta after birth, but we don't. And I've seen midwives, they'll, clean it all up, of course, and then slice it into little cubes and then like put those cubes in the freezer. And then every day or like every meal, you take a little cube and throw it into a smoothie and you don't even taste it. And then, but a lot of people make pills out of it and they'll take those pieces and put them in a dehydrator and grind them up. And there's services that do it for you. So you don't have to do it, but it really isn't that hard. It's like any other, looks like you have a steak in the refrigerator or something, it's like, it's really.
Like a flank steak, probably.
Yeah, it's not that big of a deal, but yeah, so they can prepare it. And then, but when you have a rapid hormone change, that's one of those reasons for doing the placenta. So your hormones are at a certain level when you're pregnant and then all of a sudden it's gone.
Take birth control.
Yeah, so you just, you would take, say like 3 pills 3 times a day to 2 pills 3 times a day to 1 pill 3 times a day to maybe 1 pill a day and then every other day, and you taper off so that your hormones are a gradual descent rather than just boom, it's over, deal with it. So that's just, one thing that's going on with hormone changes. There's also the physical and emotional stress of birthing. So some people really didn't have that great a childbirth education, didn't know what they were headed for or how to cope, with the labor. And even when everything goes great, it's a pretty traumatic. I don't know if that's the right word for it, but it is. I mean, your life is never the same, and things people say to you, the way you were made to be, the way you were made to feel. I don't know how to talk today, but that has a lasting effect. And then there's the physical discomforts as well. So there's this emotional letdown after pregnancy and birth, and the awareness and anxiety about the increased responsibility combined with sleep deprivation and fatigue and disappointments of your birth. Maybe you had a birth plan and nothing on your plan happened, everything else happened, and you feel very disappointed about that. Or maybe you were really upset with the way that your spouse or your support person, what they were saying or doing during labor or after the birth. Maybe they were having trouble nursing the baby, or maybe the baby itself isn't like acting or looking as you had expected. I know, like maybe if the baby has colic and just crying all the time and you don't know, no matter what you do, like you've done all the physical things. And anyway, so there's a whole 3-day class on that I teach about the newborn, but all of these things. And so, you know, some statistics show that untreated depression in pregnancy increases the risk of postpartum depression by 50 to 80%. So if we catch this and get some counseling and some support prior to the birth of the child, we can increase some of those statistics. There are some symptoms of a postpartum affective disorder that you should, know about. Some signs that they might be headed in the wrong direction or are there already. Difficulty getting in and out of bed or severe sleep disturbances. Rapid weight gain or loss and altered eating habits. Sustained use of alcohol, sedatives, or other medications. Serious accidents related to fatigue or inattention. Uncontrollable crying and mood shifts. An inability to think clearly. Planning or attempting injury to yourself or to another. So those are all kinds of signs of depression as well. So postpartum depression, there's a major depressive disorder recurrent with postpartum onset, which affects 20% of all new mothers. The onset's usually gradual, but then can be rapid and begin at any time within the first year. And despite what the DSM says, which is the Diagnostic of Statistical Manual of Mental Disorders. So yeah, we'll go on. Pregnant women with a diagnosed fear of childbirth are at greater risk for postpartum depression. There's a quote here that says, having a fear of childbirth puts women with no history of depression at approximately 3 times higher risk for postpartum depression. That was a study done by the University of Finland. So again, education, learning coping skills so that we're not afraid of giving birth. That will help prevent postpartum depression as well. And there's not just postpartum depression, there's all kinds of mood disorders. So there's postpartum OCD, obsessive compulsive disorder. It affects 3 to 5% of new mothers. They might have symptoms of non-psychotic, intrusive, persistent thoughts or images of the baby being hurt or killed. I think it was Brooke Shields that talked about that. She said she would have like a vision or something of throwing her baby in the dryer and the baby getting round and round in the dryer and beat up and bleeding. And it would be like, why did that even enter my head? And then she felt guilty about that. And like, what is going on? She had severe postpartum depression and OCD. And she talked about it, I think it was on Oprah back in the day. And that was back when Tom Cruise was into Scientology and they were going back having this argument. I don't know if you remember that, but that was a long time ago. But thanks to her, there was a lot of information that came out for the first time when a movie star actually admitted to having it. And then I think Marie Osmond was another one who talked about it. She had a whole bunch of kids and then one day she just like got in her car and drove like states away. I forget what. I believe that was her. But once famous people start talking about it, it's like, okay, it's a real thing, It does happen. Also could have intense irrational fear that the baby may be harmed. So almost like a paranoia, and it's not irrational, it's an irrational thought or behavior. Could have irrational behaviors to reduce related anxiety. Tremendous sense of horror and fear about these thoughts and images with an awareness of their irrational nature. So then you feel bad for thinking about those things, but you can't help it. So they need to get help. There is also what's called a postpartum panic disorder, and that affects 10% of postpartum women, where they'll actually have a panic attack, which sometimes makes you feel like you're having a heart attack, racing heart, difficulty breathing, sweating, shaking, or a sense of being out of control. So these physical reactions. And sometimes it can happen during pregnancy as well. You can start having panic attacks, but, or you could even awake from sleep with a panic attack without a trigger, but usually there's something that triggers it. And then it can increase your feeling of helplessness and inadequacy. Okay. PTSD is more in the news these days. So postpartum post-traumatic stress disorder. And that can occur in 1 out of 6 postpartum women. And usually that is related to a traumatic birth experience. It can also be related to a prior sexual abuse. Sometimes people who were sexually abused when they have a baby feels like another violation, or brings that repressed memory to surface. Depression and anxiety tend to co-occur. I've heard that anxiety are feelings that you get from unresolved things from your past, whereas depression is worrying about your future and you can't stop worrying about it, but they go hand in hand. Sometimes PTSD is related to a fear that your depressive or anxious symptoms will resurface. So maybe you don't have it yet, but you're worrying about it happening. So what causes mental health disorders? All related to the mother. So what kind of environment is the mother in, and what kind of stressors is she experiencing? Then it also can be related to biological processes and epigenetics, which is the study of cellular and physiological traits that are inherited. They're heritable by daughter cells and not caused by changes in your DNA sequence. Relational stressors, so to everybody the mother comes in contact with, maybe a mother, a mother-in-law, her husband or partner, other children, friends, everything's changing. So everything has a factor on that. So take a look at those too. So some of those environmental stressors could be her housing, where she's living, or her work or professional life, her finances, or does she feel safe? Those are all environmental stressors. Biological could be your hormones and your history of mental health prior to this. Thyroid, that's huge. I think I'm going to talk about that. Infertility. Relational stressors. So sometimes guys don't stick around, they feel abandoned, or maybe they're still married, but the guy's just working extra hours so they don't have to be around the baby or her or that situation, and they just feel abandoned and all alone. Or, he has to work to support the family, and you're just at home isolated, nobody around. So partner struggles, parenting struggles, whether it is parenting or sexual or just the relationship changes. Family of origin or the in-law family. Just,
That's a good one.
Mm-hmm. Unsolicited advice from other people can sometimes, And then epigenetics, so your limbic brain, changes to the genes in your hippocampus or your memory, the estrogen induced, and then there's these cells that you inherit, again, something that you inherit, say like even, they talk about the genes that you inherit with breast cancer, and some people who don't have breast cancer that say have a mastectomy because they carry the gene. There are certain genes that predispose you to postpartum depression as well. So here are some risk factors for postpartum depression. 50 to 80% chance of postpartum depression if you had a previous episode. There's a 50% risk of depression or anxiety during pregnancy. So if you had it before, you might have it again. Personal or family history of mental illness or substance abuse. History of severe PMS, premenstrual dysphoric disorder. Prior perinatal loss, so whether it was due with infertility for trying to get pregnant and trying to get pregnant and trying to get pregnant, and then every time you get your period, the sadness that comes with that, and then finally it happens, but then they're just kind of dealing with all of that afterward, or you have miscarriages or all those kinds of things. Or abrupt weaning. So maybe you could breastfeed, although you can get it back. So if mom and baby were separated and the baby was in the hospital, and breastfeeding would be too much of a stimulation for the baby, and they had to feed the baby intravenously, and so she didn't get a chance to breastfeed, you actually can get that back. It takes a little bit, but I've known several people to relactate after drying up, and it is possible, but with support that can happen. If it stops abruptly, that's a risk factor for depression. Other risk factors make sense: past abuse or neglect or trauma. Mother's loss of her own mother. So this is a time when maybe a lot of girls get really close to their mother and kind of have this newfound empathy for what her mother went through, and you have a different relationship with your mother than you've ever had. So if you lose your mother during pregnancy or when right after the baby's born, you find like that void extra hard and can lead to depression. Medical complications in the mother or baby, social isolation, a poor support system, mood changes while taking birth control pills or fertility medication, and thyroid dysfunction, all are risk factors. And then, I don't know, Jane the Virgin is a popular series right now on Netflix. If you haven't seen it, I was really happy to see that Rogelio is one of the characters in there. He had paternal postpartum depression, and they were saying, that's not a thing. You don't have a baby. You can't have postpartum depression. And I was like, I have a slide about that in my lecture. I'm like, it's a real thing for sure. But yeah, he says in there, guys have hormones too. And they really do. So I was happy. It actually was like on a sitcom on TV that they were drawing attention to this. So, so some symptoms of that would be a lowered stress threshold, where girls tend to cry. Guys tend to have anger or aggressive reactions to stress. They might be feeling burnt out and empty, feeling restless and withdrawing from other people, denying that there's any problem, or they might respond by overworking or increasing their alcohol intake or using other substances, like medical marijuana is popular right now, and just refusing to get help. Guys are way less likely to go see a counselor. Most of the time they have to be forced to do it, and other guys go gladly and recognize that there's a problem, but just want to draw attention that it is important for men to have the eye-to-eye contact, skin-to-skin contact, holding the baby on their chest, smelling the baby, seeing the baby, kissing the baby, changing the diapers, and important for mom to allow him to do it. I think there's a tendency of a mom when she has a baby in her womb for 9 months, it's all hers. And when she has the baby, now she has to share it with other people. And sometimes critically, like, you're not changing it right. You need to do it this way. And pretty soon, the guy's just like, you know what, do it yourself, and doesn't participate anymore. Well, guys need to participate, because just the act of taking care of the baby, those feelings of engrossment, releases prolactin, which is the mothering hormone, which again is the opposing hormone of testosterone. And so as testosterone lowers, prolactin rises, and then the man is going to have naturally a feeling of nurturing and wanting to take care of the baby, along with oxytocin, and falling in love with the baby. And so he's going to want to nurture and protect and love the baby instead of competing for love with the baby. It's just not natural without those hormones in place. So we have to allow them to have their time with the babies. So maybe mom's breastfeeding, you know, every 2 hours, of course. So maybe let dad get up, go pick up the baby, hand the baby to mom. Mom nurses the baby, hand the baby back to dad, let dad burp the baby and put the baby back down. So involve him as much as possible, and then those hormones will come up, and that will help prevent postpartum depression. So it really doesn't matter whether you're male or female or what race you are. It really doesn't matter how old you are. It affects adults, teens, Caucasian, African American, Latina, Asian, you know, immigrants, all these things. So just know that it really doesn't matter. It affects everybody. Sometimes people don't go get help because they don't want to have that stigma of being labeled as a crazy or a bad parent, or maybe it's not covered by insurance and they're, you know, you're already spending a lot of money. Maybe you had to spend it on birth and newborn care and all that. And so you don't have money to pay for psychiatric care. Maybe there's a lack of awareness or education that there's help out there. And then, you know, sometimes when people are depressed, they don't have the energy to even seek out help and withdraw. So depression can affect them. So treatment, there is medical interventions, social interventions, and therapeutic interventions. Our medical interventions would rule out any other medical causes. So sometimes there's other reasons. Like in my case, when I had my first daughter, I thought I had postpartum depression, and they told me that probably highly unlikely, because I was already past the point usually that where you would still have it, that you kind of outgrow postpartum depression. And that's kind of my tone on the other slide, that it can happen at any time. It's not that it has to happen within the first 3 months postpartum depression. But in my case, it really was a different medical reason. I had a thyroid problem. I was hypothyroid that I had developed from sleep deprivation. I had a child with colic, and she cried pretty much nonstop for 9 months. Anytime she was awake, she cried. And my husband was gone, worked for the airline, so I was all alone for 4 days at a time. And I remember 1 week, I think I got 8 hours of sleep in 7 days. And I was pretty much out of my mind, and I was crying at coffee commercials on TV. I remember there's a Folgers commercial, and I just started crying because it was touching. I mean, you know, any little thing. I remember my water heater or something like that broke, and the service guy came and he said something, and he was late, and then he was rude, and I just like had like a freaking meltdown. And I'm like, I'm sorry, I just had a baby, and I was just thinking like, what is wrong with me? And I went to the doctor and I said, I think I have depression, you know, and he's like, well, let's do some blood work. And we did some blood work, and he goes, well, I know why you feel depressed. He's like, you know how off your thyroid is right now? And then I got the medication and I took one pill, and like 20 minutes later, I felt like me again. Like, wow. Yeah. So sometimes it takes a while for medication, but in my case, that's a personal thing that happened to me. And I had postpartum thyroiditis. So, so medical is important. You might want to see psychological, but it's a really easy thing to go get some blood work and see if your hormone levels are where they're at, you know, maybe you're deficient in some area. And then do a psychotropic medical evaluation as well. And they can find out through surveys and little tests to find out if it's like true depression. All right, so therapeutic interventions and psychoeducation, we want to help her understand intellectually what's going on. So we need to provide some education. We want to stress that she's not alone. We already looked at the statistics and saw how popular this is, and find out about social support services. And right now with social media and the way things are, that's one good thing, that there are so many Zoom meetings and other ways to connect with people, Facebook groups and Instagram and whatever. I mean, like there's groups out there everywhere. And then support her experience of grief. So it's a very natural thing to long for the life that you had before. So yeah, I mean, you know, if you have a cucumber and you go through the process of pickling and now you have a pickle, that pickle can never be a cucumber again. Right? She might want to be a cucumber, but yeah, so you go through the stages of grief almost as if when somebody dies, but you're grieving your old self, your old life. And that's a natural, normal thing. Foster a cathartic experience. So we had somebody in here yesterday, so I'm not gonna share her story or her name, but you know, sometimes you start talking about a subject and then all of a sudden it all comes up and the repressed memory comes out and she shares it for the first time. Well, that should happen as soon as possible after birth, and allowing women just to tell what happened, whether it was a good experience or whether it was a bad experience. Women need to tell their birth story. And then we want to help them promote self-care. And so discuss some ideas for self-care. And it might be, you know, I think it's not uncommon for people to like have a goal of, I'm just going to brush my teeth today and the rest of the time is going to be newborn care. And they're in their pajamas day and night and not taking any time. So we really need to try to help them get some help with the baby. There is postpartum doulas, like we talked about birth doulas, but there's actually postpartum doulas. There's newborn care specialists. There's mommy groups up there that can help and will actually bring you meals and help watch your baby so that you can take a nap. You can go outside, sometimes just going outside and looking at the clouds or this, you know, nature, going for a walk, even if it's 15 minutes and come back, it just can restart. So it doesn't have to be these huge things where you know, go out, just, I don't know, like using your senses, like taking a hot shower, lighting a candle, having some aromatherapy, just changes in your senses, vision, sight, smell, taste, and yeah, massage, right? Social support. So we want to explore your client's values around social support. Is it a common thing culturally? Familiarize yourself with services in your area. So I like to have a sheet of references when I know a mom's coming in and she's a new mom to, are you aware of this group? Are you aware of that group? I have a little handout to give to her. Encourage clients to consider starting their own support group if there isn't anything in the area. because I guarantee it's needed. And help to educate family about what your client is going through. So if you see both the husband and wife in your practice, you know, maybe helping the husband to understand what she's going through, yeah, from a non-biased point of view. All right, so we want to assess client support, which means who can she talk to? Who can she call in an emergency? These are questions we should ask. Who can she call for childcare, transportation, and help? If she says no one, right, we need to help find resources for her. So why care so much about maternal depression? Who does it affect? It's not just the mother, right? It also affects the baby. If mom's depressed, she's not responding to the baby's nonverbal language. Maybe she's only responding to the cries, and babies need to be responded to the nonverbal. Babies will look at their mother's reaction to different things. So it affects the infant and the child. It affects attachment, building a secure attachment, having that child feel safe and secure in their home. So it affects the whole family. And when children don't feel safe and secure, they usually end up with behavioral issues and learning disabilities. So, you know, we have had a lot of school shootings and things like that. All of this actually affects the entire society at large. If untreated, it can become chronic depression, and that impacts the woman, the child, the family, and greater. It also can have a multi-generational impact. We talk about the epigenetics. One of the most significant mental health issues impeding children's readiness for school. And it increases the incidence of childhood psychiatric disturbance, behavior problems, poor social development. It has implications for impaired attachment, and it also has the potential for child abuse and neglect, right? If they don't have any tools and they get frustrated, that is one of the symptoms and reasons why. Let's take a little look at what is the difference between a normal baby blues versus depression, because baby blues is when the hormones drop, and it is normal to have some mood swings, some anxiety, sadness, irritability, crying, decreased concentration, and trouble sleeping. Well, no kidding, you get woke up every 2 minutes, or every 2 hours. So that's all normal and temporary. So when it's not, let's take a look at that and when to suggest help. So, and there's a difference between depression and psychosis. So when untreated, postpartum depression can last for a year or more. That includes a loss of appetite, insomnia, intense irritability and anger, overwhelming fatigue, loss of interest in sex, lack of joy in life, feelings of shame, guilt, or inadequacy, severe mood swings, difficulty bonding with the baby, withdrawing from family and friends, and then thoughts of harming yourself or the baby. Versus psychosis, you can actually get into your having hallucinations or delusions, having illogical thoughts, so almost like a paranoia, insomnia, refusing to eat. So that's different than not being hungry. You're just refusing to eat. Extreme feelings of anxiety and agitation, periods of delirium or mania, or suicidal or homicidal thoughts. So these people need to get help. Okay. So this one, you can see the fundal massage.
Okay.
And this is what happens right after the baby's born. People don't talk about this happening, but they'll come in and they have basically one hand's going to go right above the pubic bone, and then the other hand's going to push down on the top, right? And maybe I'll share my video. How do I do that?
Probably a good idea to ask her if she needs to use the restroom before doing this.
This is something that like nurses will do. It's not really a massage therapist thing. No, I don't want to do that. How do I put my video on? It's there, but when I go to put it on, then it disappears. A second. Well, you can see in the photo there. I don't know how to get it to go. Yeah, so this is something that the nurse or maybe the midwife would be doing. And so even after you have a baby, you still look like you're pregnant. That's another thing people don't talk about. Like for about a week, your stomach is still really big. But they have to get the fundus, which is the top part of the uterus, down. But they'll have to put the side of their hand there. You can see the bottom hand right above the pubic bone. So they're going to have to put that in there so that when they push down on the fundus, it's not pushing the organs. They don't want to have an organ prolapse coming out the vagina. So the cupped hand down on the bottom is going to hold one end and lift away and up from the pubic bone and hold that stationary, while the top hand is going to go right on the top of the uterus and start to massage it down. So they don't feel like that's all hanging down in there. And so this is pretty uncomfortable, but you can breathe through it, but it's a necessary thing and it's a natural thing. So it's just something that happens right after you have a baby, called the fundal massage. And then in some hospitals, they do a routine Pitocin injection in the thigh instead of doing this. Sometimes if there's fragments of a placenta or for whatever reason, a woman will start hemorrhaging after they have a baby. And in that case, they would need Pitocin. But some hospitals just do that instead of fundal massage, just routinely. So that's kind of interesting and controversial and nobody talks about it. So just want to bring that to attention. Oh, and we're going to have a little forever until my PowerPoint starts advancing every time I do a new one. So let's say I just had a baby. What I can do is, well, maybe I should use this hand. So you find your pubic bone and you use this part of your hand and you're going to put it right above your pubic bone and just kind of like dig it in there, and that stays put. The other hand is going to come on top of the fundus and is going to start pushing down, like push my stomach out so you can kind of see. And so you're just going to massage and try to get that down from every angle. Switch hands. So that's just a way to work on the fundus on yourself. Okay, and I'm going to try to get the picture. Well, we will move on, and then I'll show some techniques for this as well, what we can do, and maybe we can just do it on our own tummies. Okay. And I can try to put it back onto the full knee again. But so something else people don't talk about a lot is after you have a baby and you look down at your stomach, you'll have like all this extra skin hanging down that maybe you weren't prepared for. And it looks kind of like this, except, yeah, I mean, sometimes there's a lot more than that. So if you've ever seen somebody who maybe did a HCG diet or did a stomach surgery for weight loss, gastric bypass or whatever, and then they lose a lot of weight really quickly, they'll have a lot of extra skin hanging there. And it's kind of like that. So it's trying to tone the skin, and we could do it with those people as well, to try to tone the skin and get it, but it naturally will come back within time. It will come back. But there's a way we can do this working with the dermatomes in the skin and activate a reflex response of the connective tissues. As we do this, you'll see a skin coloration change. You'll get like a hyperemia on the stomach. And the client should experience that, like a kind of, you know, what do you call snake bites on your arm when you feel like that kind of burning sensation. Yeah. So tearing, slicing sensation, and you can shorten the amount of the area if it's too intense. I'll show you how to work one continuous circle, spiraling at the navel and then working out, and then working along the edges around the ribs and around the hips and that. I'm doing little rib commas. So I'll show you this routine myself, and then I can show it on you as well, like demo it on you. And then also how we could use cupping therapy to do it, or maybe another type of instrument-assisted soft tissue mobilization to stimulate that. But if there's extra skin, we have to be careful of the pressure because we don't want to suck up too much excess skin and pinch the skin with cupping therapy. So you got to be careful with that. All right. So we're going to start at the navel and just make clockwise circles all the way around till we get up to here. And this is done without any lotion whatsoever. And because it'll be all really loose skin here, we're going to have to counter pull away. So you're going to place your finger, hold the skin, and then hook your finger into the tissue and then drag it away. And then you're going to continue that. And then you're going to have to switch hands. So then you're going to place, hook, hold the skin, drag away. And I'm going to keep going. Place, hook, drag, pull and drag. And I'm just going to keep going around in these circles. And I can even, like, I can use my thumb. It doesn't have to be my finger. So here, I'll just show it with my thumb. Whatever's easiest for you to use. It doesn't have to be the index finger. Any finger, 2 fingers, right? Whatever's easier. Sometimes with edema still in the body, get that pressure from all the fluids in your wrist, and you have feelings of carpal tunnel when you're pregnant. So it's not really carpal tunnel from overuse and stuff like that, but it is the same feeling as carpal tunnel, and just pressing your fingers can give sharp pains in your wrists. So maybe it's easier to use your thumb and do this. Right, so I'm just gonna keep going till I get to the edges of the iliac and the edges of the ribs, and I have a whole circle. And I don't know if you can tell if I have a hyperemia here. Can you see kind of like a bullseye? Yeah, so that's kind of what it would look like. So I can do maybe like 3 reps of that, and then just leave it alone and do that every day to help tone the skin. And then once it gets a little bit more toned, maybe I can do some cupping therapy. And I can do that to myself, but I'm going to show you how to do it to someone else. So I'm going to set up a video and pause this, and then I'll demo on Allie. Okay.